I can see what you're seeing.
Sure.
Yeah.
You're good? Okay. Good afternoon, everyone, and thank you for joining us today. My name is Emily Mooney, and I'm the project lead of the Community Knowledge Program at Wellesley Institute. We begin. We wish to acknowledge this land on which Wellesley Institute operates. For thousands of years, it has been the traditional land of the Huron-Wendat, the Seneca, and the Mississaugas of the Credit. Today, this meeting place is still the home to many Indigenous people from across Turtle Island, and we are grateful to have the opportunity to work on this land. Welcome to today's webinar on the impact of COVID-19 on racialized newcomers with disabilities in the GTA. The Community Knowledge Program aims to encourage collaborative research and knowledge sharing within the immigrant and refugee sector in the Greater Toronto Area. We work to fill existing gaps in how researchers, policymakers, and community agencies collaborate to conduct research and apply its findings to frontline work with newcomers. We conducted a needs assessment in 2021 to understand the gaps between research and practice. One way that we are addressing these gaps is through panel discussions to convene leaders from different parts of the sector to speak about their experiences and perspectives on research and knowledge mobilization. Over the past few years, the Community Knowledge Program has been considering how to promote settlement research and evidence-based practice in frontline work with newcomers. We've looked at successes and challenges and begun building capacity in the sector through our public webinars, training for frontline workers, and a new community of practice to support researchers, practitioners, and others engaged in supporting newcomers to our area. In today's session, we will be discussing a recent research project about racialized newcomers with disabilities during COVID-19. 3 speakers involved in this research will describe their experiences and findings and discuss how their findings can support frontline practitioners to improve settlement outcomes. Before we get to the speakers, I wanted to go through a few housekeeping notes. Please keep in mind that this webinar is being recorded. The video and the transcript will be available on our website within the next week. If you require subtitles, you can enable live transcription by going to the meeting controls at the top of the screen and select more options, then language and speech, and then turn on live captions. Please note that the chat function is enabled for this event, and we encourage you to use it as well as the Q&A feature to participate. We're going to start with our panelists' presentations, and then we will come back together for questions afterwards. We have 3 wonderful panelists that we'll hear from today. First, we will hear from Jheanelle Anderson and Dr. Chavon Niles. Jheanelle is a Black disabled social worker and researcher committed to advancing disability justice and equity for Black Canadians. Her work focuses on the intersection of Blackness, disability, and immigration, advocating for systemic change, and inclusive policies through a disability justice lens. Jheanelle has a background in community-based research, having led projects that examine gaps in research, policy, and service delivery for Black Canadians with disabilities. Notably, Jheanelle provided expert witness testimony at the Standing Senate Committee on Social Affairs, Science, and Technology regarding Bill C-22, the Canada Disability Benefit Act, sharing her insights on the unique experiences and needs of Black disabled Canadians. Her recent work includes the Assafe Community Foundation's Capacity Building Research Project, Intersection of Race and Disability, funded by Employment and Social Development Canada, that sought to improve the social inclusion and full participation of Black and racialized persons with disabilities in Canada. Dr. Chavon Niles is a Guyanese Canadian researcher, scholar, educator, and advocate dedicated to justice, equity, diversity, and inclusion. She earned her PhD from the Ontario Institute for Studies in Education at the University of Toronto. Dr. Niles is an assistant professor in the Department of Physical Therapy, cross-appointed in the Rehabilitation Sciences Institute, Tamarty Faculty of Medicine, University of Toronto. She also completed a postdoctoral research fellowship in the Department of Physical Therapy, Faculty of Medicine at the University of Toronto. Chavon holds a master's degree in critical disability studies from York University, where she focused on the perspectives of regular and special education teachers on teaching students with individualized education plans, IEPs. She also earned a Bachelor of Education degree from the University of Toronto, specializing in primary and junior education, and an Honors Bachelor of Science degree from McMaster University, with a strong interest in supporting students with visible and invisible disabilities. Lastly, we will hear from Rana Hamdy. Rana is a first-generation North African immigrant and a second-year Master of Physical Therapy student at the University of Toronto. Driven by a passion for health equity, Rana is dedicated to amplifying the voices of immigrants with disabilities and addressing systemic barriers that disproportionately affect marginalized and racialized communities. She holds a Bachelor of Science in Kinesiology from McMaster, where she also minored in theater and film. During her time at McMaster, Rana's experiences sharpened her awareness of the systemic challenges these communities face, igniting her commitment to health equity and qualitative research. At U of T, Rana serves as the second-year equity representative on the Student Council, where she advocates for inclusive practices and policies that promote fairness and representation for all students. Additionally, as a research assistant at the Access Lab under the mentorship of Dr. Niles, she contributes to research exploring social determinants of health and health disparities. I'm looking forward to the discussion today, and let's get started with Dr. Niles and Jheanelle Anderson.
Thank you, Emily, for that really wonderful introduction. So we're just going to ask Colleen if you could please share our slides, and we will begin. So the title of our presentation today is The Impacts of COVID-19 on Racialized Newcomers with Disabilities. Jheanelle is going to start, followed by me, and then Rana. Next slide, please. So here is how we imagine this conversation unflowing today. We really wanted to begin by speaking about how this team was put together. And Jheanelle's going to talk about how we went about building collaborative and sustainable relationships. She's also going to give some great suggestions to folks that are interested in conducting community-based research on how to do that in a way that is respectful to community members we'd like to work with. I'm then going to speak a little bit about our research study and just some of the findings, and speak a little bit about the importance of this work. Rana is then going to talk about her own reflections on the coding process, being a relatively new research assistant, and implications for future work, as well as some other projects that we are currently working on, given all this great work we have done. I also want to mention that this study was funded by the Rehab COVID Network at the University of Toronto, and it is based on a pilot study. So with that being said, I'm going to turn it over to Jheanelle.
Thanks so much, Chavon. So to start, I wanted to tell my story, in which, because it helps to situate how I approach this work, the lens that I use with this work, and where I fit in this work. I was born and raised in Jamaica, and my journey to Canada began around 2002. My dad had sponsored my brother and myself, but only my brother was successful. I was denied because of my disability, and they said that it would be a burden on the healthcare system here. I reflected a lot on this moment in my while I was completing my master's degree, and I really saw how much, trauma and internalization of like this idea of being a burden, this ableist idea of being a burden, and how that really skewed how I viewed myself, viewed how worthy or useful I was, not only to my family, but to friends, to this country in general. It made me refuse help in all aspects of my life. I did an amputation, we reapplied, I was successful. And then my journey in Canada began in 2008. Later in life, in adulthood, I was diagnosed with a chronic illness. And during my master's, it really became apparent that there was a very, very large gap in this research area, but also in policy and how services are delivered. The work that I engage in centers the experiences of Black immigrant people with disabilities. I share my story not for pity. That's not the takeaway from me sharing it. It's one, to situate myself in this work, and position myself here, but also to share, I want folks to share in my anger at this ableist system, right? I want folks to act in ways that challenges everyday and systemic ableism, no matter where your work takes you, the populations that you're serving. We always have to see how disability intersects in that work, but also the different identities that intersect within disability. I am reminded of Alice Wong's quote in Disability Intimacy, her book, about how we claim disability identity and how claiming it, while it brings harm, it also brings a lot of pride. And for me, identifying and seeking out opportunities to connect with other folks with this experience really allowed me to build my community and build up my networks. It allowed me to learn a lot from other folks with disabilities, but also unlearn these, things that society was telling me about how I should view myself, view my disabled body, viewed how useful or worthy I was. And it was very validating in building community through this identity. I met Chavon through our work as part of the then advisory committee and then co-chairs of the board at Disability Justice Network of Ontario, DJNO, and have since then collaborated on many projects at this intersection of immigration and disability. One project was our collaboration where I shared my experiences during the height of COVID in accessing my prosthetic services. Before COVID, I was in the middle of getting a new limb, and this is one of the primary ways I get around. This is my main mobility. And during the height, I no longer had access to said services. So this led to me sharing this with Chavon. We were published in the Medium Conversation. And this article led to us working on a paper that's been recently published on essential services and the COVID-19 pandemic, which we co-wrote with other academics from other academic institutions. And this paper led and impacted, how we approach this study that we're going to be discussing today. It really showed that there was a strong need to do this work. And so leading to just kind of what we see on the slide, we really must understand how reciprocal relationships are a key part of this work that we do in community when we're thinking of research. We must understand how mutual respect and understanding how the research problem is constructed is important. Oftentimes, how the problem is defined is from the researcher's lens and not necessarily the community's lens. So that really approaches how people that really influences how people approach the work. So oftentimes also lived experiences are particularly aren't seen as true expertise. And particularly for folks with disability, we're often treated passively in these areas where folks might see the relationship as extractive. My lived experiences at these intersections has led me to pursue research, such as the reports that were mentioned in my bio through ESHE Community Foundation for Black Canadians with Disabilities, where, I looked at Blackness and disability using a disability justice and Black feminist lens to look at the invisibilization of Black disabled Canadians and how anti-Black racism and ableism function together. My role on this research project and through my collaboration with Chavon on our many works together really solidified where we came to a mutual understanding. I trusted her because we had the same understanding or the same lens of disability. She understood the systems of oppression that were at play that impacted newcomers or immigrants with disabilities. And that is where that mutual understanding, the shared goals of this, were really decided, and that really helped build and sustain trust. In this work on the impact of COVID-19 with racialized newcomers with disabilities, I supported with recruitment, also in co-designing the study and provided feedback on the initial analysis of the themes. It was through my connections with ESHE Community Foundation that we were able to share about the research project with through their network with Black newcomers with disabilities. It was also very important that, because we understood the systems of oppression, we understood the nuances of how Black folks, immigrant folks might relate to disability and the harm that might come to folks because of the system, legal exclusion of people, that labeling of burden as well. We understood that, so we met people where they were. It was so important that we built in multiple ways of communicating and reaching folks and ensuring that they saw themselves in this research, that they trusted us with the information that they were going to provide us with. And when you understand these systemic issues of how marginalized folks navigate the systems, you are better able to understand and better able to reach and build those connections and relationships. I'm just going to kind of tie this back into what we're seeing here on the slide. In how we approach this work from an intersectional lens, that's always very important. We are not a monolith. The community is not a monolith. We're all approaching this work, disability work, differently, with different histories and ties to disability and colonialism and anti-Blackness, etc. It's again, I'm going to reiterate, trust building, mutual respect, and shared goals are very key. Transparency in this work, not over-promising, but really laying out what we're doing, why we're doing this, what is going to happen with the data or the information that they're sharing. And then, kind of like trusting that something will come out of this work. So that they're not sharing in vain, so to speak. Communication is such a big part, again, tying that back into transparency and how we communicate as well in plain language, making sure that everybody understands what we're doing, but also keeping them updated on where, the progress of the that was very important for me in how Chavon and I worked. Reciprocity. Again, oftentimes research is extractive, and we want to make sure that there's mutual benefit in this work, but also sustainability in this work. So my relationship with Chavon didn't just start and end at DJNO. We found many ways of connecting both of our expertise in this work, where Chavon has really included me in these different projects to ensure that my lens, my lived experience, again, as a Black person with a disability, is included at every stage. Next slide, please. Before I wrap up, I wanted to share Arnstein's Ladder of Citizen Participation. It is a framework that outlines 8 levels of public involvement, and it ranges from manipulation at the very bottom to citizen control at the very top of the ladder. While it is typically used in citizen engagement work, I think the ladder is a really good guide to seeing how power, who has power, and when important decisions are being made. And I think it's very applicable, again, to how research, how we approach research. At the lower prongs, we have manipulation and education, which are more non-participative. Next is informing. So again, it's important as a first step to legitimate participation to inform, but too frequently the emphasis is on one-way flow of information. There's no channel for feedback. And then there's consultation. I think this is often the most way we engage folks in research or engagement, citizen engagement, et cetera. But oftentimes this is seen as like a window dressing, as again, views are sought, but decisions are not made by those who are most impacted. Next, we have placation. So this is where, there's co-option of people who are handpicked, who are worthy to be on committees. It allows those folks to advise or plan, but it retains for power holders to have the right to judge who's legitimate or who holds feasibility for advice. Then we have partnership. So power is in fact redistributed through negotiation here between the power holders and people impacted. Planning and decision-making responsibilities are shared. Then we have delegation, which introduces more accountability. And then at the very top, again, is the true citizen control. So while we can look at the ladder, we can think about how we are engaging vulnerabilized communities. We can apply this to how research is undertaken as well. Typically, like I mentioned, research somewhat is viewed as extractive. Some researchers might exploit marginalized communities for, their expertise, their data. Oftentimes it's not valued in the same ways. So paying folks for their expertise, especially disabled people, the implications there, but not offering meaningful benefits or involvement. Folks not considering the unique histories and ongoing interlocking oppressions. True partnerships between researchers and communities on the margins are essential for addressing, disparities similar to the project that is going to be spoken to today, but also how Chavon and I have approached the work as researcher and community and people with lived experience. This involves, again, true collaboration, reciprocity, mutual respect, really the researcher positioning themselves in the work and really looking at the lens that they're bringing to this work. And again, sharing in the decision-making process. And then I'll pass it back to Chavon. Thank you.
Thank you, Jheanelle. So before I get into the formal part of my presentation, you're going to hear Rana talk about the work that she does in the Access Lab. And our Access Lab is about advancing critical disability studies for equity and social change. Our lab aims to answer the following question: how can critical disability studies and health equity frameworks be used to mobilize rehabilitation and health services research to address the growing disparities in outcomes between underserved communities locally and globally. Um, I think also Jheanelle did a really great job positioning herself. And as I was listening to my bio, I recognize that there's an opportunity for me to share a little bit about who I am and how I come to this work too. So I am a community-based researcher, and some of you on the call might already know of the organization called OCASI, the Ontario Council of Agencies Serving Immigrants, which acts as a collective voice for the immigrant and refugee serving sector. So for 8.5 years, almost 9 years of my life, as I was going through my PhD at U of T, I was working at OCASI. I was a senior coordinator where I led a community education program focused on supporting the immigrant and refugee serving sector to better understand and respond to the needs of newcomers with disabilities. And as I was, going through this role in the community, I wanted to bridge what I was doing in the academy too. And so my research study, my doctoral thesis, focused on understanding the experiences of racialized immigrant youth with disabilities. I'm a settler myself on Turtle Island. While it wasn't my choice to leave my birth land, it was my choice to stay here and have a family of my own. I'm also a caregiver, for a parent that's aging who is listening right now on the call with my sister, and seeing my dad and how he was navigating the healthcare system and the complexities that he was experiencing also motivated me to, localize my research, looking at the experiences of Black, racialized, and disabled folks and how they navigate healthcare, health services within, in Ontario context. And now I'm also looking at it globally, specifically in my country of birth, Guyana. So I'm going to ask if we can go to the next slide. And so working with Jheanelle and other community members through, working at OCASI and meeting so many amazing people across the province of Ontario, when COVID-19 hit us, and Jheanelle and I were talking about the stories we were hearing in addition to her story, we felt there was not a lot of research and just a lot of information about how racialized disabled people, racialized disabled newcomers specifically, were navigating rehabilitation, health, and social services. So we came together, we did all that work Jheanelle told you that we did, and then we put this grant, this pilot study together to understand people's experience and then to document recommendations out on how to decrease inequities to these services during COVID-19 and beyond. And this is really important. We felt it was important that we understand like this is not the only pandemic. There will be future pandemics. What are we going to learn from this? We also used a critical disability studies and critical race theory framework because we felt they both use counter narratives to challenge racist and ableist ideologies. And Jheanelle said this in her presentation. We look at how inequities are built into the social fabric of our society, how ableism and racism and other systems of oppression intersect with each other to shape and inform people's experiences. And we wanted to use storytelling. We also collected our data through demographic questionnaire and semi-structured interviews. So in total, we interviewed 10 folks. We actually have over 10 people right now on a waiting list that are waiting for us to come back and interview them. But for the pilot study, we really, our goal was 10, and we have applied for other funding that Rana is going to talk about later so that we can continue to hear from this population. Next slide, please. And I really want to speak to you a little bit about what narrative inquiry through storytelling is. So it is a qualitative research method, and it focuses on collecting and analyzing stories to understand individuals' experience, and it helps us to make sense of their lived experiences. As a qualitative researcher who uses narrative inquiry, I view stories as data, right? They are these personal stories that are being told by participants. They are a primary source of data that provide insights into participants' lived experiences, how they navigate the social, cultural, political, and institutional context. Narrative inquiry is also about meaning making. So it emphasizes how individuals make sense of their experiences. And so, as a qualitative researcher, my goal is to explore not just what happened in participants' life based on what they're sharing, but interpret those events and constructs using critical disability studies and critical race theory, those frameworks. It also focuses on contextualizing or contextualized understanding. And what that means is that through storytelling, we get a deeper understanding of the social, cultural, and political factors that influence people's experiences. It situates the personal narratives within a broader systemic context. So again, instead of blaming people for their lot in life, we start to look at how racism and ableism and immigration policies, reveal the impact of forces that impact people on a personal level. Parindosa has done some amazing work using narrative inquiry and storytelling, and her work focuses on racialized disabled immigrant women. And through storytelling, she actually challenges dominant discourses around disability and race. And so I drew a lot on the work of Parindosa to conduct this research study. Next slide, please. So this is just a demographic of the participants that we interviewed. Six self-identified as female, four self-identified as male, eight self-identified as Black, and two self-identified as Middle Eastern. Next slide, please. And here are some of the emerging narratives that came out of this research study. Number one is the importance of understanding systems of oppression, how they shape access to and participation in health, rehabilitation, and social services, and that some factors were exacerbated by the COVID-19 pandemic. So participants spoke about feelings of isolation or being seen as the other of the other or being othered. Jill talked about she wasn't able to get the service that she needed during COVID-19 because it wasn't deemed essential. And in our paper that we wrote, we discuss who and what is deemed essential and how policies that are created by our government determine essential people and essential services, and everyone else is relegated as the other and was then invisibilized. Participants also spoke about how they only access services in a moment of crisis. And this was really, really an important finding, right? So many talked about surviving and not thriving, and the level of care that they received outside of crisis was not sufficient. So it took like having a mental health crisis, having COVID, and trying to get services and not actually getting it. You'll hear from one of the participants in our study where she talked about how she was, experiencing COVID-19, and the physician told her she was just experiencing symptoms of being a newcomer to Canada. And we call that immigrant reductionism, where all of our experiences are reduced to our status in Canada, as opposed to the fact that we are actually sometimes experiencing health crises, but that's not seen as valid by some healthcare providers. Participants also spoke about what we call protective factors. So those that were fluent in English or had access to financial resources, they did not experience the same level of barriers than participants whose first language was not English, for example. Next slide, please. Thank you. So here's the story of Regina, who's a 20-year-old racialized disabled immigrant woman living in the Greater Toronto and Hamilton area. And I'm just going to read the little blurb about Regina's experiences. And this is the pseudonym that Regina chose. So soon after the start of the COVID-19 pandemic, Regina migrated alone from Nigeria to Hamilton, Ontario to pursue post-secondary education. She has mental health disability, which began in early childhood but had not accessed formal supports for it in Nigeria. Regina experienced a mental health crisis upon arriving to Canada and was admitted to a hospital. With limited social supports in Hamilton, Regina had to learn how to navigate a complex and unfamiliar healthcare system. A few days after being discharged, Regina fell ill with COVID-19 symptoms. She experienced significant difficulty accessing a diagnosis and treatment. She was dismissed by a healthcare provider who told her she was experiencing challenges in adjusting to her new life in Canada. Regina is not the only story that we heard like this. Many participants in our study spoke about their experiences being dismissed and assumed that what they were experiencing was because of issues with quote unquote assimilating to Canada, as opposed to really having different crises that they were experiencing. Next slide, please. And I'm just going to read you some of what she says. I remember going to her office. She's speaking about the healthcare provider. I was just telling her when I woke up this morning, I felt really weird. I'm telling you, I literally was getting COVID right in front of this lady. And then to her perspective, it was just like, oh, well, you just moved to Canada, you're black, and that's what's happening. You're just adjusting to like the weather. I'm telling you, my signs of COVID literally exposed themselves right in front of a medical doctor, and she didn't do anything about it. And I'm telling you, this doctor was just so blind to it. Even when I was trying to tell her, I feel like this, I feel like that, and she was like, don't worry, it's just you transitioning. And I'm like, girl, I've been here a month and a half. And I just want to share that when I conducted my study with racialized immigrant youth with disabilities before COVID-19 happened, almost all the participants I spoke to said the exact same thing, that whenever they spoke to a healthcare provider and sometimes a social service worker, their experiences or the challenges that they were experiencing was because of their newcomer status in Canada, as opposed to having mental health crisis or experiencing that. And that assumption is really dangerous. And as Jheanelle said earlier, nobody is a people don't have monolithic experiences. Just because we have similar stories doesn't mean that our experiences are all the same. Next slide, please. So now I have the pleasure of turning it over to Rana, and Rana is going to go through the coding process with you. She's going to reflect on her own experiences and just share a little bit about the studies that we are now hoping to be working on to continue this important work.
Hello. So before I get started, I just do want to acknowledge that I am on my second placement, which I'm doing in Northern Ontario. So I'm in Sioux Lookout, which is in Northwestern Ontario. So I'd like to acknowledge that I am in Treaty 3 territory, and the land on which I am speaking from and gather from is the traditional territories of the Ojibwe and Chippewa people. Which I've been learning a lot from them and a lot from the Anishinaabe people about storytelling and representation in our system. So just wanted to mention that. So just to begin, we're going to be talking about the coding process. So we started by familiarizing ourselves with the data using critical disabilities studies and critical race theory. So two transcripts were read by the research team, and we specifically focused on how participants discussed disability and race using the two theories. So we looked for themes such as ableism, racism, and their intersections, as well as power dynamics and marginalizations. So once we finished that first step, we moved on to generating the initial codes from two transcripts. So the initial codes were created, including theory-driven codes like ableism and intersectionality, as well as racialized experiences, to really capture the participants' experiences of oppression, identity, and resistance, which then led us to developing our codebook with input from the research team. So the initial codebook was developed collaboratively by two research assistants and the principal investigator. The codebook included clear definitions, examples, and guidelines for when to apply each code, ensuring that the critical disability studies and critical race theory principles of social construction and systemic analysis were included in this process. So through this collaboration, the codebook was refined and expanded, ensuring it reflected both the theoretical frameworks and the data. Then we moved on to identifying broader themes. So the refined codes were grouped into larger themes such as structural oppression and agency, emphasizing how disability and race intersect in shaping participants' experiences within systems of oppression. And then we had a final review of the codebook and themes, and we collectively reviewed these codes and themes to ensure that they accurately captured the intersectional nature of participants' experiences, making necessary refinements to the codebook for consistency. So the final codebook was then applied across all the interviews by the research team, ensuring a consistent approach informed by critical disability study and critical race theory, focusing on structural barriers and identity-based narratives. So next slide, please. Perfect. So I was very nervous when I first started this project. I felt a little intimidated because I realized that there was a really big responsibility of telling these participants' stories accurately, especially when those stories come from diverse and marginalized communities. And it really reminded me, so during my time at McMaster, I was a TA for a theater and film course. And we talked a lot about this book by Thomas King, who's an Indigenous writer, called The Truth About All Stories. One of the quotes that he talks about in his book really resonated with me, and it said, the truth about stories is that that's all we are. And it really resonated with me because it reminded me of how, yes, this is data, an analysis, and it's important for the research and the work that we're doing, but it's also stories, and these stories shape how we see ourselves and how we are seen by others. They also carry meaning and influence, especially in contexts like healthcare, where people's positionality personally influence the kind of care and support that patients, or a newer term that I've been exposed to, clients receive. And that's something that I've even been seeing now as a physiotherapy student on placement. So I had to do a lot of research on qualitative research, narrative inquiry, and how to code. The Access Lab also has an incredible team, and under Chavon's mentorship and another RA in our lab, they both walked me through the coding process. I also remain critically aware of my positionality as a researcher and the potential influence it could have on interpreting the data. So I am an immigrant, I'm Egyptian, I'm also a woman, I'm temporarily able-bodied, I'm a caregiver, I'm a physiotherapy candidate. So all of these things intersect to create my identity, but it also helps me understand my biases. And I think through this work, you're constantly kind of reflecting and learning and relearning. So recognizing my own background and experiences, I engage in a reflexive approach to ensure that my positionality did not unduly shape the coding process through the use of critical disability studies and critical race theory, which provided a solid theoretical framework that helped mitigate the risk of imposing my personal perspectives on the data. These theories emphasize the importance of centering marginalized voices, focusing on systemic oppression, and understanding the social construction of disability and race. By adhering closely to these frameworks, I was able to prioritize participants' narratives on power, marginalization, and resistance over any preconceived notions or biases I might have brought to the analysis. Additionally, I practice ongoing reflexivity, questioning how my own identity and position in relation to power and privilege could affect the interpretation of the data. This helped me ensure that the themes and codes were grounded in the participants' experiences, as articulated through the lens of critical disability studies and critical race theory, rather than being filtered through my personal viewpoints. So this process has made me reflect not only on my role as a researcher, but I think definitely on my role as a future clinician. I feel a really deep sense of responsibility of not only ensuring that these stories are heard, but also understood. And I think, as I mentioned previously, I'm working on checking my own biases and ensuring that I'm approaching this work with humility and knowing that this isn't just data that we're collecting, but they're human beings behind these interviews. And I think Chavon and I really want to highlight that we are not making these voices more visible or amplifying them. We are listening, and that is something that our system has failed to do so. So we're in this position now where we're listening, and I think all of us need to listen, especially those of us that are clinicians and are in those positions of privilege. So this is also really important when we have this trend of researchers with minimal to no background in health equity rushing into the field in response to the growing demand of equity-focused work. Their work isn't sincere or genuine. As such, it lacks meaning. And this is why, as health equity researchers, we have to ask ourselves 3, or I think 4 very important questions. Who am I? Why am I doing this work? Who is benefiting from this work? And what am I bringing to this work? So we just wanted to, referencing the last point, the term health equity tourism. So this might be a new term to some of you. It's a term that refers to a phenomenon in which researchers or academics, often without sufficient expertise in health equity, engage in health equity research superficially, primarily for career or reputational benefits. This approach is problematic because it leads to poor quality research and reinforces existing inequities, particularly in academic spaces. So instead of contributing to meaningful work into our field or engaging with marginalized communities, these individuals participate in health equity research in a way that dilutes its goals and impact. So we referenced the article there, and it's an excellent article. It emphasizes that true health equity research requires more than surface level involvement. It demands a commitment to working closely with communities affected by inequities and to truly have a deeper understanding of the social, structural, and historical context of inequity. It also highlights the importance of educating and guiding novice researchers to become responsible and engaged members of the health equity community. So next slide, please. So next, we just wanted to mention our knowledge to action for equitable care. So there is a need for implicit bias training and improved education on systems of oppression and equitable care for settlement, immigration, rehabilitation, and other service providers. And I think it's also really important that as providers, we understand the impact of COVID-19 on the barriers and facilitators that racialized disabled immigrants experience when accessing or attempting to access services. So participants already have limited access to healthcare due to their immigration status, language barriers. They also experience social isolation, and COVID-19 has added that extra layer onto the barriers that they've already been struggling with. And we need to understand that there's many barriers to access for this population, and COVID may and will exacerbate this. So some of our next steps for the study, we have, as Chavon mentioned earlier, we have a waiting list for those that want to be interviewed. So we're aiming for a larger study with a larger sample size. So next slide, please. Perfect. And these are some of the grants, or 3 of the grants and projects that we are currently working on. We also did want to mention that people with lived experiences are being represented as collaborators and community partners. For example, the first grant that you see there, the CIHR, we're informally collaborating with the YWCA so that their stories and voices of people with lived experiences are being accurately represented. So yeah, I will pass it back to Chavon.
Thank you, Rana. That was a lot. You did a good job. I want to share that the work that we're doing, and I hope it comes through the presentation and the story that Jheanelle started us with, and the way that Rana's ending is that this work is really rooted in humility. We do not know everything. The 3 of us, we have our own knowledge, our own way of viewing this work, our own lived realities. And so we come together with other amazing people on the team. 2 other people on this team is Dr. Karen Yoshida and Dr. Yaya El Hadid, who's actually a professor at the University of Calgary. Dr. Yoshida is a professor at the University of Toronto who recently retired. So they worked with us to put together this research study. And from that, we've now expanded to these 3 projects. And these 3 grants that we've submitted, they're different iterations of this work that we have done. And they also speak to the need to continue to advance this work. And I want to end with an example for you folks. So I've had the benefit, I would say, in being able to be in different spaces. And I was working at a hospital once where I was doing health equity work. My job was to work with healthcare providers and social service providers to help them understand how to embed a health equity lens into their practices. And at the end of one of my talks that I did about, the benefits of using a health equity lens, I had these surgeons turn to me and say, "Oh, Chavon, this work is good, and I think we can just get our administrative staff to do what you do, and they can just, train everybody on how to do this." I had so many different thoughts as that was being said to me. And I chose humor in that moment. And I said, oh, that's really good. Thank you. So I could then go on YouTube and watch 2 videos on what you do and then come to the OR and then I'll be good to go. And we all laughed. And the reason why I chose humor is because I don't think the intent was to put down this work that I've spent almost 20 years of my life focusing on. I think the intent was to say, well, this work isn't that important, it's not something I'm used to, or health equity, EDI, these are all words that have been co-opted, right, by large institutions, and they've been diluted. But I wanted to show how certain knowledges, certain ideas get dismissed. This work has been happening long before this research study has come together. And as Rana said, we always start from a space of saying that nobody is violent, no one is voiceless. We just need to listen better. And if we're struggling to listen, maybe we need to change our approach. And I hope that you see through this presentation that that is the intention of the Access Lab, is to listen better, is to ground ourselves in humility and understand this is how we care for each other. So thank you for this opportunity to share our work, and we look forward to engaging in some questions with you.
Hey, thank you so much for truly remarkable presentations. There was so much rich information in there, and it's a joy to hear about your work and to find that there are folks who are so deeply rooted and embedded in this work and have been so committed to it for such a long time. It's very encouraging. So thank you. Thank you. I'd like to open the discussion for anyone who has any questions about what's been presented or about anything that you would like to hear more about, maybe any topics that weren't raised. So I'll wait a moment for any questions to come in, and I've got some questions for you myself as well. If we don't have anyone raising their hand at the moment, my first question for you would be, well, actually, let's see. We have one person raising their hand, so let's hear from Anna, please. Anna, do you have any questions?
Yes, hi. Thank you so much for this. I was trying to type the question, but I realized it was probably easier to say it out loud. Amazing presentation. This is absolutely fantastic work, and I cannot wait to find ways to collaborate with you. I work with the CNIB. My colleague Kia is in the call as well, and I have to say, this work is tough work. Hearing the stories that you're sharing, one feels it to their bones, right? Like for us, I'm a researcher as well with the CNIB, and for us researchers, many times we're hearing these stories and understanding the realities of the system. I was wondering, was there anything that you and your team did to ensure self-care, to ensure that that you're not burning yourself out while doing this work, while still understanding the realities of the system that exists, right? Like this work is great work because it moves things forward, but we are where we are. So I was wondering, are there anything that you can recommend for researchers like us doing this sort of work?
Oh, that's such a good question. Are folks okay if I start? And then I think it'd be good to hear from both of you as researchers too. So I will tell you, when I was doing my PhD, that was the hardest, because as a newcomer to Canada, like I came when I was 9 years old, and it was a really hard transition. And I didn't realize how I was so drawn to the stories of newcomer youth because of my own challenges as a young person to Canada. And it took me a year after collecting the stories to actually start analyzing it, because it just brought up so much from my past that I hadn't dealt with. And I realized that's why I wanted to be a youth worker. That's why I wanted to work in the settlement sector. I was always doing justice work. I just didn't have the language at that time to help me understand and the why. So given that experience, when we do the interviews at the beginning, we never do the interviews by ourselves. There's always 2 people that do the interviews with the participant. And after the interview, we try as much as possible to do a quick debrief with the 2 interviewers. We check in with each other. And our last question is always, how are you caring for yourself? The other RA in the lab, Kelsey Vickers, she and I are the ones that did the interviews together. And then eventually, sometimes things happen when we felt more comfortable, we would go off and do the interviews on our own. The initial coding, we did it as a group. We chose 2 transcripts, and the whole research team came together. We coded those 2 transcripts. But then after that, it was Rana and Kelsey that worked together to do the coding. So the coding was never done on their own. Rana and Kelsey also wrote notes, and they were able to connect with each other, and they also connected with me. So what I always want to do in the lab is I say, this isn't just, it's not head work, this is heart work. Heart work is painful work, right? It's hard work, it's subversive work. And in doing that, we need to have conversations. And I I hope the team will say this. Like it's like an unwritten rule in the lab where we can talk. Like we talk about whatever comes up. And I really do push for taking breaks from the work. Because if we are not okay, we cannot ensure that we are sharing the stories in the way that needs to be shared. So folks take breaks as they need it, and there's no judgment. You're supported however you need to be. And I'll pass it over to Rana and Jheanelle to share too.
Yeah, I was just going to say, Chavon was really great about, especially when I first started coding. And I think it's acknowledging and validating it's okay to feel angry, especially as an immigrant. I felt like a lot of emotions, but sometimes it's okay to step away for a second and kind of gather your thoughts and validate what you're feeling. And then stepping back into the work, I think is the most important. And it's okay to feel frustrated because we work in a broken system. But I think personally for me, I would take that energy and those feelings of anger into it's gonna, fix the system and help more people and help more people like me and like us. So kind of turning it into some positive energy as well. I don't know if Jheanelle had anything to add.
Yeah, really echoing what Rana and Chavon mentioned. It's such a different experience doing this kind of work. Like, as a person with lived experience, as a person who've experienced similar things, as the people that you might be interviewing, it's such a different experience. There's like an extra layer of like you yourself feeling because of your positionality, but also you're kind of like in a position of power that you feel a responsibility to solve everything, and it won't happen. We're giving space to folks to share and, validating that experience. It's like a byproduct of doing these groups, focus groups, right? People don't necessarily always have the space to talk so candidly or unpack what they've been experiencing. And they're doing it, kind of processing that in interviews sometimes. While also like me as someone with lived experience, sometimes hearing those stories, it's hard. Like, both Chavon and Rana mentioned, it's super hard. But it's really kind of like taking a step back. Having community is so important to just release, express your frustration. They get it. But knowing again, the system is the way the system is. It was never meant, like the work that is being done here was never necessarily meant to like flourish in the same ways because the system was built to exclude us, right? So just kind of understanding it, that, the system wants you to operate in a box, but the work, like Chavon mentioned, is meant to dismantle that. So it will take time for the system to catch up in the ways that, honor, like truly, truly honor justice work and honoring these experiences to start addressing it. But that I'll just end my thought there. Thank you.
That's all.
Thank you so much.
Yes. Anna, thank you for the question. Do you have any follow-up or?
No, this is absolutely fantastic. Thank you so, so much.
Okay, thank you. There's such rich material that we're talking about here, and I think that the idea of doing the work, even though it's hard, it's possible to take some solace from the idea that we're doing the work at all, that the work is happening and that it's going out into the world, and it will change some minds. It can help dismantle systems. And though it's very difficult, it needs to be done. And it's very good to hear about the ways that you are looking after yourselves and making sure that the difficult part of it is not doing you harm. Yeah. Thank you. Thank you. And we have another question, this one from Akea. I'm sorry, I can't see your full name, but I'd like to give you a chance to unmute and ask your question.
Hi, thank you so much. And my name's Kia Osborne. So I also work with Anna Sophia. So I identify I'm a Black woman with vision loss. And wow, just hearing the work that you're doing, you're bringing in your lived and professional experience. This is so enriching, and thank you for the research that you're doing. So for my question, so I come from more of the programming community background, and partnering with those who from academia and research. So as we're also, what we're trying to do too is bring in the discussion of health, equity, and healing with the intersectionality of race and disability. Question: how do you, especially as we're bringing in the storytelling, which is so important, how do we avoid, becoming tokens or tokenizing the people who are uh, relating these stories for the qualitative research? I think it's a bit of a two-part, because I know that, myself, I'm coming from the disability community and trying to do the work, but how do we avoid tokenizing the work, and how do we protect the community we're serving
That is such.
from becoming tokenized?
Thank you. I started the last time, and I want to give the team an opportunity to decide who'd like to go first.
Yeah, I can start. Yeah, that's such a great question. And I think oftentimes we don't consider it. Like I think mentioned it a bit earlier. Oftentimes the way how research kind of like operates, especially with like communities and like disabled communities, people who've been like harmed by research, it's been extractive. So we take the information, we run with it. We don't go back to community. We don't share back what we've learned, how, this could use for capacity building. That sustainability piece is missing. Oftentimes too, I think organizations might hire someone in these roles as well, like tokenistically, and they take on so much of the work, like I mentioned, that there's this labor piece, this emotional labor piece of, dealing with the isms within the workspace as being a lone person doing this work with lived experience, but also, bearing responsibility for the people with similar lived experiences that you're serving. I think it's really great that we consider how we don't tokenize these experiences. It's really, what are we doing with the information? How are we sharing information? What are the next steps with the information? How are we involving the people who, like, again, what they share, the information they share isn't just something that we throw away, right? These are expertise that they're sharing. And how do we honor and value that is so important. How do we be transparent about the work is important. I think for me, that's like one of the biggest ways. Again, that idea of reciprocity is that not only the researchers who are benefiting, not only the organization is benefiting, the people who contributed the actual bulk of there's no research without that expertise. So like, how are they, benefiting from that, right? It's beyond just them sharing, right? Sharing storytelling is amazing. And we have to think beyond that as well. We have to kind of look at ways that we are valuing their expertise, whether it's monetarily, but also sustainability. What capacity building are we, the reciprocity. So we're capacity building, but also what are they benefiting from this in terms of building their own capacity? Is it to like carry on this work? as peers in community, spreading that, building their research capacity. I think it's so important that it's a two-way streak so as to not tokenize the experience. But that's an excellent question.
Yeah, and I agree with Jheanelle completely. I think we lost Rana, so hopefully she'll be able to join us soon. So the first thing I wrote down was relationships and reciprocity. Like this work that we do is rooted in relationships. Jheanelle and I are not just collaborators, we are friends. We value each other as humans. And it starts from that perspective. Every single person that I work with, that works with me, there is a relationship there. And it's always about a give and take that benefits all of us. If I say something to Jheanelle, a framing of a question, and Jheanelle does not agree with it, we have a conversation. We have a conversation about the why, and we make sure that whatever we move forward with, then we're comfortable with it. We also recognize the harm that research has done in the past, the harm that research is doing right now, and the harm of health equity tourism, where people that have a large labs have won a lot of other grants that are not rooted in equity. Now that the three big funders are asking that research is rooted in equity, are doing this work. Jheanelle and I we have different lived experiences, but we also have decades of experience in training in critical methodologies and critical social theories like critical race, critical disability, intersectionality. Jheanelle mentioned, Black feminism, post-colonial theory, and our work is rooted in these theories and frameworks that have been used for so long. And so we bring that into the work that we do. We also ask ourselves intentionally, who's part of the team? And the team decides what the research is going to look like. It's a collaborative effort. I don't think I've done something yet or led something or been part of a team where I'm being added at the very end. That's not rooted in community-based research. Together as a team, we decide on the research study. The CIHR grant came up. I get all these grant notifications and I messaged Jheanelle and I said, hey, what do you think about this? We had a conversation about it and we moved forward together. But again, it's that relationship that decides what's going to look like. And we are co-PIs, principal investigators on that grant. Um, we also always share with participants what we're doing with the information. So when we apply for grants and we do the consent form, we share with participants where their stories will be told in a manuscript at a conference. If it's going to be, if we're being asked to do something that we never told participants about, we will never share those stories. We make sure that participants know, and we also provide them back with the transcript so they have an opportunity to read, to revise, and to say, I don't want to do this anymore. Participants also have a right to, choose not to participate in the research study. And so going back to what Jheanelle said, who is doing the sharing is equally important to who's asking the question, is equally important to who's part of the team, right? So it's not just about the stories, but who's actually doing the telling. Are they grounded in these critical social theories, right? And then how are people benefiting? How is everyone benefiting? For our research study, we provide an honorarium for participants. We want to honor people's time. And sometimes the academy views honorariums as like a monetary incentive. And we counter by saying we are asking folks that have become marginalized, have been made vulnerable, are underserved to share their stories with us because the systems are doing exactly what they were intending to do. And now we don't get any issues about providing honorarium for participants for their time. And then, where we give our labor. So I don't remember. There's this amazing professor I met, and she said, I sell my labor to the institution and I give my labor to community. And so as a researcher that's located in the university now, that has been located in community much longer, I give my labor to community and I choose where I sell my labor. So it doesn't always mean that there's, some type of monetary gain that's attached to the work that I do, because I do believe in the importance of being in community in a really intentional way, and doing this work. And so I guess the last thing is that, yeah, because our work is rooted in relationship building, there's also different opportunities for participants. I was in Guyana, my birthland, at the beginning of this year, and that work came about through relationships with community members and disabled folks living in Guyana that are now going to actually come on the next part of the project as research assistants. We're really hoping it gets funded. So there were participants in the pilot study, and I've asked them to come on as researchers assistants. So they're benefiting in a different way, and they're part of, co-creating that study and then sharing. And that's the goal of the Access Lab, is to make sure that we are hearing from those that are most impacted. Thank you for that great question. Rana, did you want to add anything?
I guess the one thing I would want to add is also holding these systems accountable. So I think what's really cool about research, I'm very new to this, but having a knowledge translation or knowledge to action. So how are we holding practitioners and healthcare providers? How are we holding them accountable, and what recommendations do we have for them? And how are their institutions holding them accountable, or rather, how are they holding their institutions accountable? And I think Chavon does a really great job, is that as she teaches, she also teaches us at the University of Toronto. And I think as future clinicians, that's something that a lot of us have started to think about, right? Concepts like ableism and racism and inherent biases that we might have and bring with us. How do we unlearn? So yeah, that's all I wanted to add.
Yeah, thank you so much. These are really valuable insights, and I see a lot of application for them to other areas of service as well. It's not just health equity, it's also settlement work. When people are interacting at settlement agencies, the settlement workers need to examine their own biases. They need to understand why it is they're coming to their work. And the whole point of the community knowledge program that I'm leading here is to help build those research relationships, connect people with each other. And I'm so glad to be hearing about all the work that you folks have been doing about building the relationships and establishing the mutual trust, which is really crucial if people are going to share their stories with you accurately, and if you can do anything with the stories to try to promote change. We've held a couple of webinars already about building and sustaining successful research relationships, and everything that you have been saying here is very consistent with what other speakers have identified as what to keep in mind when academics are working with communities and communities are working with academics.
Can I add one more point?
Please.
Excuse me. Jheanelle said this earlier. We pay people for their labor. We do not believe in a free labor. We really believe in the Access Lab that, especially when we are working with community organizations, you get paid for your time. And that is really, really important. We have advisory committees. People get paid for their time, because when we think about extraction, when we think of those of us, again, that have been most harmed, it's those of us that are, you're seeing right now on the call. And working in community also as a frontline worker, and then, behind the scenes at OCASI, I really saw the value in ensuring that people get paid well for their labor so that they can actually do this work. They can actually carve out the time, and it's not something that you're doing at the side of your desk. It also means we move slower because we always have to explain to funders why we're paying people for their labor. And it just comes from this space that we don't have the time. And so we need to make that time. And that in itself is so subversive and so exciting that we do that. So yes, we do move slow, but we're okay with that. We're okay with the pace that we're going.
Slow and steady wins the race. Yes, yes. Okay, great. So we've heard a whole lot about relationships, and we've also heard a lot about stories and whom you trust to share stories. And Rana, I was so thrilled to hear you quoting Thomas King, because I have quoted that exact same line in previous webinars. It had a huge impact on me as well. And there's another writer who did some work about narrative. longer ago. Thomas King, that quote was from his Massey lectures that he did for the CBC. And longer ago, another writer, Robert Fulford, who passed away yesterday at 92, wrote a series of Massey lectures about the power of narrative. And that was the first time I really got thinking about what stories do and how they work, and who has them, who tells them, who protects them, who's responsible for them. And I think this is absolutely something that we always need to keep in mind in research and even in relationships before we get to the research at all. Yeah. So,
Um, so
yes,
sorry,
Rana.
I just wanted to comment on that. It's really interesting that you say that. So as I mentioned, I'm in Sioux Lookout right now, and we've been learning a lot about the Anishinaabe people and their ways of storytelling. And I was at a drumming ceremony yesterday, and one of the elders, his name's Rolf Johnson, he mentioned that when I speak and when I talk about stories and stories, it's a huge part of Indigenous culture and Anishinaabe way of life. No one listens, but when the white man speaks, everyone listens. And I think that's so important. The work that we do, and thinking of who has like held those positions and whose stories have always been told and who's been telling our stories as well. And how do we reclaim that, and how do we kind of challenge the system and, as Chavon said, dismantle it. Just wanted to mention that.
Yes, that's a very, very important point. And I think that as researchers based in more Western systems, we really need to pay attention to Indigenous values, perspectives, and understandings, and develop our own understanding, our own humility in drawing from their traditions and their work. Yeah. Okay, so continuing with the theme of stories, I was hoping you could talk a bit more about your narrative inquiry approach, because I think this is something that a lot of researchers may not be as familiar with. And the idea of narrative inquiry, like looking at the stories, drawing the themes from the stories, things that may not be heard in other ways. What made you choose this approach, and how did you find it benefited you?
I think it's because I come from a culture that values story. So I am Guyanese. I was born in Guyana, and the way that we pass down knowledge is through stories and proverbs. Proverbs are like these very short phrases that convey so much meaning. And I've always like oral history is just something I grew up with. When I became a youth worker, I was listening to the stories of newcomer youth. So I've always been fascinated by stories. I've always been fascinated with, again, what stories get told. There's this really good proverb, like until the lion tells their own story, the tale of the hunt will always glorify the hunter. So until the lion tells their own story, the tale of the hunt will always glorify the hunter. Who gets to be the storyteller? Who gets to be the hunter, who gets to tell the story in the way that they do. And so working at Ocasi also, and being, immersed in an organization that's also rooted in storytelling and amplifying the stories of immigrants and refugees. When I started my PhD, I knew I wanted to do something that was bridging what I was experiencing at Ocasi. I got to travel across this province, the province of Ontario, and meet service providers and people with lived experiences, people with disabilities across the province. And so I was looking for a methodology that would allow me to capture that. And I came across the work of Dr. Parindosa, and she wrote a book called Racialized Bodies, Disabling World, right? Please excuse me if the title's incorrect, but and in that book she used storytelling, and what she did was she was able to weave the stories with the theories. And she said that from the inception of a thought, we need to ground it in theory. You know, we live and breathe theory each and every single day. Theories help us make sense of the world that we live in, whether we are aware of it or not. And so I saw how Parin Dosa did that in her book. And so I drew inspiration from that book and said, let me think about what I'm experiencing as I'm traveling across Ontario. I'm meeting with these service providers, mostly social service providers and some healthcare providers and newcomers with disabilities. And so, how can I then bring that into the academy? And I noticed that in my research group that I was in, my the group of us that were doing our PhDs, folks were using different, qualitative and quantitative approaches, but no one was using storytelling. I think at this time, this was in 2012, 2013. Stories were just not seen as a big thing at that time. It was like big data, generalizability. And I always think about the people that fell within the cracks, like me, my own experiences as a new immigrant to Canada, the stories of the people I was hearing across Ontario. And so I brought all of that I was learning in community into the academy. And thankfully, I found Parin's work and I drew inspiration from it because I wanted to tell stories in a different way where I was a vessel in which the stories could be shared using these critical social theories to inform the construction of the research study, the analysis of the study, and the telling of the story. So in my thesis, there's the analysis piece and there's also the telling of the stories, and I talk about how that in itself is subversive because I drew on critical disability studies, critical race theory, and post-colonial theory. I think what was really cool about that work I did was that I am somebody from the global south living in the global north, right? All the participants I've worked with were localized in the global south, now living in the global north. A lot of times, and you said this earlier, Emily, stories in the global north get extrapolated into the global south to make sense of people's experience in the south without what I call the three C's: context, culture, and the legacy of colonialism. And my job as a storyteller is to share those stories through these theoretical lens, grounding it also in context, culture, and the legacy of colonialism. So I had phenomenal people to draw on, and my job was just to add to their knowledge. I also drew on the work of Dr. Normala Orveles. She uses a third world feminism theoretical framework, and she was one of the first people to engage in global South scholarship around disability, the experiences of disabled people in the global South. So with Nirmala Orveles and Parin Dosa's work, I was able to bring that together and just evolve my work. And in the lab, I think all we've done so far is storytelling. I shouldn't say it like that. It's a good thing. It's not a bad thing.
It's a good thing. It's a great
It's a
thing.
good thing. We've done
Yeah.
it's subversive work. Like we're telling stories in a different way that needs to be told.
Telling stories in a different way that need to be told and hearing them from people who don't usually get to tell them in this kind of
Yeah.
context.
And something like we even, oh, sorry, Chavon.
No,
Go
go
ahead.
ahead. Go ahead.
Something Kelsey and I also noticed as we were coding the data, and she's working as a registered physiotherapist, is that a lot of patients or a lot of the participants, when they talked about their experiences in our healthcare system, they felt dismissed. Their stories weren't being heard. And a lot of the times, like the medical professionals just didn't have time to hear them. And I think storytelling is something that's important, that healthcare workers realize, like, it's important for me to sit down and to listen, and through these stories you can learn a lot. Through these stories you can actually solve an entire or create an entire treatment plan for a patient. So a lot of them, their stories haven't been able to be told. So something also to think about for clinicians.
And maybe
Yeah.
if I can add to that, Rana. So Rana mentioned I teach also in the Masters of Physical Therapy program at U of T and across the Rehabilitation Sciences Institute. And so all of the lectures that I teach are co-designed with community members. Almost every single class we have, not almost every single class, we have a community member, people with lived experiences that are co-teaching. And this year we're doing something really different. I'm bringing back students. I have students the program is 2 years long. In the second year of the program, Rana is just kind of voluntold because she's part of the lab. She's come and she's co-taught with us. Jheanelle has come out as a community member. And also we have students that have just graduated. I wanted to create something different for students where they see people with real and or perceived power, people with different lived experiences, co-designing, sharing space, and lecturing together. And this is the first year we've done it like this. Before we had guest lecturers, but just this model of having students and having community members together, that's been really amazing. And each class is actually rooted in storytelling, but it's storytelling in a different way. Um, I've tried to make it less didactic where we're talking at people and it's a bit more conversational. There's still a lecture component, but there's more opportunity to speak. And this is rooted in something we talked about last year as as we were redesigning the course. We said that at the end of the day, when people go through a training, any type of program, you're going to get the technical skills, right? As physical therapists, you're going to have those technical skills. You chose a caring profession. And part of being in a caring profession is caring about people, the soft skills. And we don't know if everyone's going to have those soft skills. And we really want to center those soft skills. And I think we're doing a really good job of that this year by having different voices, different perspectives, different people sharing space together.
Absolutely. Yeah, Jheanelle, as you as a social worker, I have the social work training as well, and I'm thinking as you were talking about doing things on the micro level, the meso level, and the macro level, and like the micro, the interpersonal things, how the clinicians or the settlement workers interact face to face, day to day with the folks that are coming to them for help. The meso ones, are the spaces accessible for them? What are the barriers and challenges to getting the services that they need? And the meso stuff, the macro stuff, the racism, the ableism, the systemic barriers, the funding models for how various services are funded. I just thought that would be one more perspective to bring to all of this that could bring some light. I see one more question from, sorry, I can't see your full name, but please feel free to unmute and ask your question.
Yeah, thank you.
Right.
It's very enlightening to see in the lens of equity groups highlighted. But I was wondering, and when you bring those equity seeking groups or lived experience, do you honor their time? Do they get an honorarium? And it's not like a tokenism, like, oh, we brought these people and we include them in our paper and so on. Do you honor their time? Do you pay them an honoraria? I just want to curious.
Yes, yes. So everyone that participates in the research study, their time is honored with an honorarium. In addition to that, when we put together a research team, as Rana mentioned earlier, almost we always ensure people with lived experiences are represented in the research team. Every publication that we have, any type of document that we produce, any presentation, it includes all of the research team members, and all participants receive an honorarium for their time. All community organizations receive an honorarium for their time. We do not believe in free labor.
Okay, good. Yeah, I just want to curious
Yeah.
because I've been seeing a lot of researchers. This is for my paper. This is for you, but not for the community. Like, what is the benefit of the
Exactly.
community? Like this is for you to lift yourself up, and the community lives in the same place year after year and been over researched. So we
Absolutely.
have enough research, but at the same time, we need policymaker people that need to amplify about mental health, disability, yes, especially Black communities who are underserved so many years. And COVID exposed those, but at the same time, we feel like we are living in the same vicious cycle of trauma again and again. Yeah, thank you for doing this. Thank you.
Thank you.
Yeah.
Thank you so much for saying that. I think just kind of uplifting is essentially what you said about the underserving of Black people with disabilities. You know, Black people with disabilities or caregivers with, children with disabilities accessing mainstream disability supports or just accessing services in the healthcare system. You know, not only are they having to deal with ableism, but also they're having to deal with racism because people don't look at, so like when you think of access, it's not just like the physical things or the attitudinal things, it's also the very real biases like built, like rooted in racism, anti-Blackness that you're having to encounter. So you're not necessarily getting the same level of support or help with navigating the system or what you get access to, but you're at every level of it, you're being dismissed. Or, I think Chavon and Rana really uplifted the quote from a participant. It's frustrating because you're having to battle two things at the same time to ensure that you're getting the care that you need. So just wanted to uplift that. Thank you for sharing.
And thank you. Yeah, and I think that's a good place to bring our session to a close, talking about lifting people up. And it's so great to hear you doing this incredible work. I wish you all the support with it. And if we've got folks on the call who are interested in collaboration or finding out more, you can reach out to me, Emily at wellesleyinstitute.com, and I will connect you with our speakers today. Also, I want to thank the panelists so much for your time. It's greatly appreciated. We've had some very thought-provoking and important conversations here, and I appreciate your perspectives and your experiences and your stories. So just a little bit of housekeeping things before we close. For access to our needs assessment and resources from our events, including recordings of the webinar, you can keep up with us through signing up for our webpage. If you go to the Wellesley Institute site and look for Community Knowledge Program, you'll find a link to subscribe to the mailing list as well as all our previous recordings. Some of you may have heard that we are in the initial stages of building a community of practice for researchers and community groups interested in research in the GTA. Over the next few months, we're going to be inviting researchers, frontline workers, and other stakeholders to join us for opportunities for networking, learning about recent research, and connection to enable you to start building and sustaining more of the kinds of successful research relationships you've been hearing about. Again, please sign up for our mailing list if you haven't already. We will keep you posted. I see a request for my email, so I will enter that in the chat. Oh, Colleen already has. I'd like to thank Colleen McDonald, our communications officer, who has been providing great support behind the scenes and who has been handling all the communications around this event. Couldn't do it without you, Colleen, so many thanks. One final thank you to all of our panelists, and I really appreciate your time. This has been a great discussion, and I look forward to continuing in future. Okay.
Thank you, Emily. Bye, everyone. Thank
So
you.
much. It's been a pleasure.
Thank you.
Thank you. Bye now.
Bye.